our biological terrain is the sum total of your internal environment. So it consists of like the gut. So we always talk about the gut. You'll hear everyone who's working on root cause wellness will typically address the gut. So we're looking at your intestinal wall. We're trying to prevent we're trying to heal leaky gut. What are we going to do to really seal the gaps in your gut and remove infections and get you feeling better? So that's a big one. Obviously, drainage pathways. So your liver, your kidney, your gallbladders, lymphatic system, all of these things. If you're not draining and you're not detoxing, you're not going to get better. So you really shouldn't start killing things in your gut, but really addressing like your drainage pathways, part of your terrain. We can look at your mitochondria, your ATP production, your nervous system. What does your cortisol look like? What do your hormones look like? Do you have a lot of food sensitivity? Are you in a toxic relationship? Nervous system is a big one. I have come to the conclusion that if you could throw all the peptides and all the spaghetti at the wall and do all the gut stuff, but if you don't regulate your nervous system, or if you're even just in like a toxic relationship, your client probably won't get better. And this is all things that are covered in terrain. It could be the bed you sleep on that is causing your terrain or, your overall well-being not to be well, because there's chemicals that could be reacting to. So it goes down to removing toxins in your environment. I mean, there's so many things that we need to look at as practitioners to really, truly the program of longevity and integrate the peptides and really move the needle to get people feeling great. So it will also help you grow your business. So on the business end of it, you're going to keep clients for years. Like my clients are usually around on a monthly membership, even at a small fee for years. They come back, or they'll come back when they know they're not feeling well, because you've taught them when things are not optimal, they're going to come back and they'll say, hey, my terrain isn't okay. Like they'll speak your language if you teach them these things. So it's not just throwing Stimorlin and Glow and Tirzepatide at them when they come in the door and they say they can't lose weight and putting them on TRT. It's more about educating them and teaching them how to really recognize when there's a problem, and then they'll come back to you. So I always say, again, movement, your lifestyle and nervous system, hormone optimization, outside influences, detox pathways, gut health. So this is sort of back to the basics. All right, so this is my client. I'm going to tell you a little bit about her, and it gets really, my intake is a 45-minute to an hour clarity call, I call it, and I do a deep dive, and I go from when they were born all the way until like the right now, and like what's going on right now, what do we need to do right now, and what are your goals? So I like to go through this because this is where you start to be able to, with practice and precision health and just working with more and more, having the clinical experience, you'll start to realize a lot of these little things that you learn about are going to give you clues into how to build your peptide protocols down the line. What are you going to do? Like if you find out someone has certain things that have happened when they were 6 years old, you're going to integrate into that plan today. Okay, so this is a 41-year-old female. She's a mama too. She's been sober 2 years, exercises consistently. And mind you, with the sobriety thing, is like I have a lot of sober people. She is not like a full-blown addict. So that's just someone who drank a fair amount. Exercises consistently, eats whole foods, prior functional medicine experience. She can't lose weight. She's tired. She's bloated. She's not going to the bathroom, low libido. So that's just sort of like the form that I initially got. So that tells you a little bit, but you'll see that it doesn't really tell you that much until you start digging deep. So I start with when they were born, the first 6 years of life. That's where I recommend you start. And here's basically why. So I asked her, was she a C-section baby or a vaginal birth? So if she was a C-section baby, right there, that tells me so much about her terrain. So right there, I will know that she did not pass through the vaginal canal. So she did not have something called vaginal seeding. So when you go through the vaginal canal, you will swallow all the mucus from the mother vagina, and that kind of sets up your gut microbiome for life. So what does that tell us? It tells us that she did not kind of have that gut immunity, that initial foundation of her gut microbiome, because she was a C-section baby, unless you request vaginal seeding, which she did not request. She knew nothing about that. So you will find when you do intakes, or I've found when I do intakes, that these are the clients or patients that have strep throat a lot as a child. They have ear tubes, they chronic sinus infections, things like that. So right there, you're already building your plan. I hope. So that's where you start to build. This is like looking at the terrain and building everything out from there. So she was on Formula at that point, it was probably something with soy. So we know that she's had a lot of GMO soy early on in age. She had eczema, sorry, that's kid. She had eczema as a kid, so we're already looking at that. That's more clues into the gut microbiome. Ear toads, a lot of antibiotics, all of this kind of stopped around age 2. So we know that there's been a few things that we need to address with her health. So no allergies. I asked about trauma in the home as a kid because that's going to impact your cortisol. That's going to impact your nervous system. So sometimes that becomes the normal of a child like that. So that is something that I would probably say, hey, well, maybe they need C-Max or C-Link or something like that to help downregulate their nervous system. Maybe we're going to need to do some pineal bioregulators because a lot of trauma really, really young in age. This is kind of stuff in the back of my mind when I'm talking to someone. So alcoholic parent, she moved around a lot, possible mold in the home. This could be linked to why she had the eczema as a kid.